Got
it?
Yeah, put record.
Okay, good evening, everyone. Let's see. We got 3 of you on tonight. The more the merrier, or the less the merrier. So we're going to get started tonight on clinical judgment for beginners, right? To help you with some of these exam questions that you'll be encountering over the next couple of weeks. Let me just. All right, Professor Graham and myself. This is part 4 of our test taking strategies. And today's objective, we're going to go over some of the key concepts of critical thinking as it pertains to nursing practice. We're also going to discuss why critical thinking is important, especially when it comes to being a successful nurse, and review some ideal methods for teaching and improving critical thinking skills. So what's clinical judgment? We know it's a process by which nurses decide on data to be collected about a patient. So this is some of the information that you'll go over to in case studies and the next generation NCLEX, and this is what the NCLEX is focusing on. Are you able to obtain or pull out the data from the patient, diagnosis, identify appropriate action, and then come up to appropriate critical thinking and problem solving? So while the nursing process, I think last week when we met, we went over several different methods on answering some of these questions, but we're going to focus a lot more also on the nursing process. And some of the things we're going to talk about are how to recognize cues, analyzing it, prioritizing, because that's one of the bigger issues also, generating solutions, taking action, and evaluating outcomes. Evaluating outcomes was one of the bigger areas they said that students also struggled with beyond just prioritizing care. So some of the key words that you need to focus on when you're answering your questions or reviewing some of your exam questions. What's best, what's early, late effective, essential, first, highest, priority, immediately, initial, next most, so many keywords. Most appropriate, and these are not trick questions because over the years, what we've heard from students is like you're tricking us in these questions. And a lot of the questions that you encounter, there'll be 4 options and they're appropriate options, but what the question is asking you, what's most important, what's most likely, what do you need to follow up on, right? Is the condition that you're looking at something expected with that patient, or is this something that's not expected that we need to follow up on? When do you need to teach, further go into teaching? What's primary, priority, increase, decrease? These are different strategic words that you'll see on some of these exam questions. So one thing that I've noticed with several of you that go through some of these exam questions, you're missing the key point and the key subject of the question. So my question for you is, what is the subject of the question? Let's look at one question, because today what we're going to focus on is breaking down some of these questions. So I'll go through this case with you real quick. So there's a case event. There's a hospitalized client with metastatic cancer. They're receiving continuous IV infusion of morphine to help alleviate pain. Part of the question query when we're looking at this, the nurse would monitor the client for which adverse effect of the medication. Let's look at the subject. In this question, note that the client is receiving morphine sulfate. And the question asked about the adverse effect of the medication. So you have all of this additional information here. Yes, the patient is in the hospital. Yes, she has metastatic cancer. But the key subject here, if you remove all of the other components, is patient is receiving morphine. What's the adverse effect of this drug? Main subject. So therefore, the subject of this question is an adverse event of effect of morphine sulfate. So here's what I'm going to ask you as far as your options when you're looking at the adverse effect of the medication that the patient is receiving. Is it 1, nausea, 2, sedation, 3, dizziness, or 4, skeletal muscle flaccidity? Yes, Arlene?
I think it's
correct. Did I say
yeah, you did, Arlie, yeah. It's
Arlie.
sedation, I think.
Okay, we got 2, sedation. Everyone else agrees? Disagrees? Questions, comments before we go on? Oh, just making sure. Going once, going twice.
No, I don't see nothing in the chat. Mm-mm.
So let's talk about this a little bit before we go into the final answer. So the key question you also need to ask yourself while you're looking at this particular question is, what does this mean by adverse drug reactions or adverse effect and side effects? So we know adverse drug reactions and side effects are both unintended responses to a medication, but adverse drug reactions are harmful and more unexpected than side effects, right? So side effects are more predictable than your ADRs, plus side effects can be beneficial or it can be harmful. Can I go into the answer I thought I created? All right, so let's go back to this question because I thought I created another little slide with the answer on there. Okay, so the correct response was, drum roll.
I don't have a drum, but I can beat on the table.
Leah, before I go into the final answer, why did you choose 2?
Because my logic behind it is in the textbook, I forget what specific thing it was talking about, but it was they were giving morphine sulfate to alleviate some type of pain for a patient, and it was you have to monitor them, like I'm not sure if it's vitals or something that you have to take every few, or just monitor them, but I remember reading something about it, and so I'm just using my educated guess. If you have to monitor them, it's probably because they're sedate. There's a chance they're gonna sedate. I don't know.
And because you know that this is adverse effect, what other key things that would trigger in your, critical thinking process to observe and monitor in this patient?
Oh, I mean, I'm not sure if this is what you're asking, but in the sense of like nausea and dizzying, I think those are like, yes, they're adverse effects, but as Professor Graham would say, risk versus benefit, like in that sense. So that's why sedation is worse. I'm sure morphine sulfate does cause nausea or vomiting or dizziness in some patients, but sedation is a lot more crucial to monitor for, I guess.
And then when you're prioritizing care too, when you're thinking airway, breathing, circulation, with the sedation, it can depress the respiratory system and also cause respiratory compromise in that patient when you're thinking about sedation. Very good, very good. Okay.
So, Ali, that was actually a good educated guess.
Very good educated guess.
Thank you.
Very good. You're welcome. Very good. Yeah.
Okay, so a lot of these questions, what they look beyond the nursing process. They're also using something called Tanner's module, and then we're also looking at what they call clinical judgment measurement model. And that's what they're really emphasizing nowadays, to really be able to recognize the cue, to analyze what's going on, prioritize it, generate solutions to fix this issue. So if you're looking at a question like we just did regarding morphine sulfate, and it causes sedation, part of that whole solution, part of the evaluation, you're going to be monitoring that patient very closely. You're going to be monitoring them frequently, maybe every 15 minutes at first, especially if they're, if it's post-op. But of course, monitoring is very important in evaluating the outcomes. The whole purpose of us giving the morphine was for pain. Now, did that morphine that we administered to the patient alleviate that pain? Is it working, the purpose that we gave the morphine for, is that actually, alleviating the issue that we're dealing with? Siobhan, did you want to add something in before I went over to the next?
No problem. I was just going to say that really clinical judgment is really, how should I say, how you really put like your assessment skills and your critical thinking skills all into one, because you're going to take a lot of like your assessments of your patient, and based off of your assessment of the patient, based off your assessment of the situation, you're going to make a decision. And that is what really critical judgment is. Go ahead.
So you're taking your objective, the data that you're collecting, and subjective information. So information that the patient is providing you with. So information about the patient. So again, here's your clinical judgment. It refers to the thought process, that clinical reasoning. It allows you, the provider, to arrive at a clinical judgment or clinical decision-making at the end. So let's look at this gentleman. Let's look at this case. You have a 55-year-old patient who's admitted to your unit from the emergency department with dizziness, severe headache, with increasing severity. Her clinical, I put a her, but there's a he here. His current vital signs are temperature is 37.4 Celsius, pulse is 108, respiration's 24, blood pressure is 189/106. In the handoff, right, in the handoff, the nurse reports that the patient vomited about 30 minutes ago. So let's look at a couple of questions here. What findings are most significant to you when you're looking at this? Victoria.
His blood pressure and the pulse.
Okay. Blood pressure is elevated, pulse is elevated.
Oh, also that like he's dizzy with severe headache, that's increasing.
Okay. Dizzy with severe headache, that's increasing. Anything else?
Yes.
Heard yes. Oh, that was you.
Sorry,
I think that was
respirations also.
Respirations you're looking at, very good.
Yep.
So what additional information is needed in this case? You got all of this data, what additional information do you need? Arlea.
What if he took any medications to alleviate the pain before coming in, or if he has any underlying conditions, history of migraines? We don't know much about his actual history. Like, is this normal for him? And he's just vomiting, stuff like that.
Okay, very good.
Very good. Very good. So what he took, what the patient history is, we got a set of vital signs. Anything else? No, we're good. Good look at other stuff too. He vomited about 30 minutes, ago. Is the physician aware of this? We did handoff report with the previous nurse. Did they give him any medication for his nausea and vomiting? There's this very high blood pressure, very good with the history. Does he have a history of high blood pressure? Did he take his medications for that high blood pressure? Any diagnostic studies that were done on top of that? So the other thing is, what questions would you ask the nurse giving the handoff, and why is this important information? So we just said a couple of things. Anything else you would ask that nurse during handoff? Besides what I just gave away?
I was just about to say, I think you kind of gave the answer with that one, but go ahead.
I was gonna say maybe like his actual pain rating scale, because they say he has a severe headache, and I'm sure it's probably a 10 out of 10 if he's hospitalized or like close to it, but like we don't know what he actually is at himself, what he thinks.
Very good.
Okay.
So let's look a little bit at the nursing process. We already know there's several steps to it. Diagnosis, the nurse actually identifies an actual or potential client issue. Implementation, the nurse performs appropriate actions. And then when you compare this to the whole system that we utilize to help you with your clinical judgment and your clinical thinking skills, what you'll see, especially with the case studies that you'll be dealing with next generation, is for diagnosis. They really want you to be able to analyze the cues. What's going on with this patient? You're reviewing relevant data on this patient. What does this information mean? He came in, he was throwing up 30 minutes ago. He has this very elevated blood pressure. He's probably nauseous, has a headache. What does this information mean? What can you kind of put together from that? Implementation. What actions are you performing with this information or this data that you've received? Recognizing cues. No, that's important. What's most significant? There's a lot of significant information in that scenario that we just gave you, right? What is actually wrong with the patient, with the information that you're being provided? Is there relevant data? Because there's going to be data that doesn't assist you with answering the question that was asked. What should you collect first? What information do you need first? What information is important for now? What needs to be followed up, right? When was the last time those set of vital signs were taken? Was there any medication given to help alleviate that blood pressure? What do we need to follow up on? And what questions should the nurse ask, right? What should you ask the patient, the family, the off-going shift regarding this patient? So here's a question I have for you. A nurse is teaching a client with coronary artery disease about dietary measures that need to be followed. During the session, the client expresses frustration in learning the dietary regimen. The nurse would take which initial action? Do you need to notify the cardiologist? Do you need to continue with the dietary teaching? Do you need to identify the cause of the frustration? Or should you tell the client that the diet needs to be followed? Yes, Victoria.
I think I would identify the cause of frustration because we like know that the diet, like we want to let our patient know that the diet needs to be followed, but if they're frustrated, like right now, we want to like be able to like kind of like work with them and we can educate them why the diet needs to be followed.
Okay. Very good, Victoria. And also too, if you take a look at like answer choice 2, like continue with the dietary teaching, you can't continue with the teaching because the patient is not receptive to the teaching. So if a patient or question is telling you about like how the patient presents, or a patient is, reflecting or telling you how they feel about something, your responsibility in that question, or the question is really assessing, can you pick up that you need to do further evaluation of that patient and assessing at the heart of what is the patient's problem in regards to the, like the teaching or the education, why they are not receptive.
Very good, very good. If you look, there's 2 things that are in common here too. I don't know if anybody noticed. 2 responses that are very close.
Mm-hmm.
Does anybody know which 2?
Do you mean the tell the client the diet needs to be followed and the continue with the dietary teaching? Like, we're not accommodating them at all when you do that.
Exactly.
Oh,
Exactly.
not at all. Right?
The
I'm still gonna
dismissive.
teach you. Right? I'm still gonna teach you, and you need to follow this diet.
Like,
It's like
do what I say. Mm-hmm.
yeah, there's no open communication here with the patient. We're making everything finalized instead of looking further into why, the whys as to why this patient is not receptive to teaching. So very good. Identify the cause of the frustration. So how do we break down this question? Note the strategic word, initial, and focus on the subject, a nursing action. Use the steps of the nursing process and apply the clinical judgment, cognitive skill, take action. In this question, a nurse needs to take an action and collect data in order to recognize cues that are relevant. So of the options presented, the only assessment/data collection action is option 3, which is what Professor Graham just said. This allows us to collect more data on this patient. Option 1, 2, and 4 identify the implementation process, steps of the nursing process. The initial action is to identify the cause of the frustration. Very good, very good.
And here's another test taking strategy too, guys. If you don't have enough data, in a question, do an assessment.
That's it. Not
There's
enough information there.
Yeah.
There's not enough information there. Go ahead and do an assessment.
That's
right?
good.
You never fail with doing an assessment.
Never.
So analyzing cues, when we look at this, what patient problem, condition, diagnosis are consistent with these findings? What findings did you expect? What additional information would help you better understand the significance of these findings? Are there data of particular concern to you, and why? Right? We looked at this gentleman, blood pressure is elevated, vomited 30 minutes ago, severe headache. Does that ring a bell? Does that alert you in any kind of way when you're looking at that? So let's take a look at this question. Analyzing. The nurse is caring for a client with a diagnosis of venous thrombosis in the left lower leg who is receiving heparin sodium by continuous IV infusion. The nurse would monitor the client for which manifestation indicating an adverse effect of this therapy. Now, before we even go into the options, this is what I find that some of you do. You see venous thrombosis, right? And you jump to the responses and you pick something that just matches up with the diagnosis rather than actually reading the question. What is the question asking me? And the question is asking me, the nurse would monitor the client for which manifestation indicating an adverse effect of this therapy. Then you need to go to yourself, what therapy? The nurse would monitor the client for which manifestation indicating an adverse effect of heparin sodium. That'll change your whole thinking now when you're approaching the question. So then you have to switch it around. You can't make it simplify it. An adverse effect of heparin, is it A, nausea, B, dark urine, C, left calf tenderness, or D, increased blood pressure?
I was gonna just add, just to piggyback off of Professor Apollon Farron, exactly like what she said, but also to asking yourself, what is a DVT? Right? Asking yourself, what is a deep vein thrombosis? And asking yourself, what are the clinical manifestations or what are the expected findings with someone that has a DVT? Because sometimes in the answer choice in which that you get, or some of the answer choices, you can automatically get rid of that because you're like, no, that's a manifestation of the disease. And the question is not asking me about the disease. This question is asking me about a specific therapy about the heparin. The second thing to also to ask yourself is, what is heparin? What classification of drug is that? What laboratory values do I need to evaluate for that particular drug? What patient teaching should I normally give someone who is getting heparin? That's also going to help you too with the adverse effect. So what do we think?
First ask yourself, with this DVT in the left lower leg, what would you expect? What's an expected finding out of those four choices?
Correct. Arlie?
So I would say what you would expect would be like the left calf tenderness, considering he has a DVT in his left lower leg. But you want the correct answer now, or?
Oh, you can give me a correct answer too.
Okay.
Eliminated C.
Yeah.
I mean, I guess I could go through them. So it wouldn't be decreased in blood pressure, because when you're giving heparin IV, you're gonna probably have some increase of blood pressure, I believe, but nausea is not that concerning. The dark urine would mean the kidneys aren't working, which I think would be the best answer.
Now, I'm going to have you think about something a little bit. What is heparin?
Is like oh my.
That's okay. Take your time.
All right. I was like, wait, am I wrong? Does it actually slow down the blood pressure?
No, you're right, but we're getting you to the correct rationalization, the correct route for that correct.
Oh, Ali, you know what your teacher is about to ask you. Stress. But ask yourself, what is heparin? So like what Professor Apollon Farron said, what classification of drug is heparin?
I'm not sure the class, but I know it's used to prevent clots.
Okay.
Okay, it's used to prevent clots. What type of action does it take on the clots?
Yeah.
I'm not sure.
Or we can break this down a little bit. Because it's used to prevent clots, other issue can heparin lead to? Victoria?
A hemorrhage.
It can lead to bleeding, right? It can lead to bleeding. Now, earlier you were saying dark urine because of kidney dysfunction, but actually there's another reason. You're correct by choosing dark urine, but the route that you got to get to dark urine is not the correct route. Now, Victoria, what she brought up was hemorrhaging, right? Bleeding. Dark urine can also indicate
blood, which would make sense. Okay.
So very important to know, the action of the drug, what type of class is it, what other issues these drugs can cause. So one of the key things, you're giving an anticoagulant medication, and this can place the patient at risk for bleeding. So the adverse effect of this therapy, we're looking for signs and symptoms of bleeding.
Of hemorrhage. Yep.
Any other questions on this question?
I would just add, like, especially like with just to remember with any classification of any anticoagulant, remember your important laboratory values that you're gonna, like be monitoring, and that the reason that you're looking at those labs is because these patients that are increased risk for bleeding, things like that.
Yeah. So what labs would you be looking at?
Me? Oh, I'm getting ready to answer. I'm sorry.
Your APTTs.
So your PTT. Very good, very good.
Excellent.
And other signs and symptoms of bleeding, your H&H, hemoglobin and hematocrit on top of that, but definitely your PTT.
And don't forget your platelets.
Yes, your platelets.
Don't forget your platelets, yes. Yes.
So what you see I did on this is I put it in blue. Again, what I find with a lot of you when you're taking an exam and you're looking at the question, you have tunnel vision when you're looking at a question. I could see many of you looking at this question saying, oh, they have DVT, left calf tenderness, but then you didn't. What was the question actually asking you? So the client who receives heparin is at risk for bleeding. The nurse monitors for signs of bleeding, which include bleeding from the gums, ecchymosis on the skin, dark or red urine, black or red stools, right? Bright red blood or dark tarry blood, bloody fluids that test positive for occult blood. Tenderness is likely to be noted, right? So tenderness is normal, noted in the area of thrombosis. Nausea and increased blood pressure are not signs of an adverse reaction of the medication. So recognize those cues. What is this question actually asking me? So the problem that many of you have
What if?
is the what if, but what if this was done? Or I remember when I was in the hospital, I had this problem and, this was the case. Or I seen a patient with this or another nurse do this, the what ifs. So the what if syndrome occurs when you read a test question and instead of simply focusing on the information in the question, you start asking yourself, well, what if? You need to avoid asking yourself this question because this leads you right into the dreadful pitfall of reading into the question. If you need to read into the question, you need additional information. How do you gain additional information? You need to further assess the patient. Shavama, you have something to add in because you look like you're jumping right in.
You said what I was gonna say. You said what I was gonna say about the assessment. What does the question tell me? If I don't have enough data, don't give me no what if. You need to further investigate. But go ahead, you said it.
Yes. You may need to think critically to answer the question. Yes, Arlia.
Sorry, so just so I'm clear, so you guys are saying like if we get like a question on an exam and we're asking ourselves, we're like, well, we don't know enough, then look for the answer choice that says continue to like assess them. Is that what you're okay?
Something that's giving you additional data.
Yeah.
Right. So if there's an option that's giving you the option to gather more information about that particular issue, then that would be the appropriate response rather than guessing what's taking place, doing that whole what if game.
Yeah, that makes sense. Thank you.
Mm-hmm. You're welcome.
So case event, this might be a little difficult for somebody because this is regarding tracheostomy too. The nurse is changing the tapes on a newly inserted tracheostomy tube, so freshly inserted, right? The client coughs.
Mm-hmm.
The tube is dislodged. This happens, it happens.
Yep.
So ask yourself, the client cough, the tube is dislodged, they have a tracheostomy. Usually the purpose of a tracheostomy is to, think of that in your head. So what is the initial nursing action? Now, for some of you, you may see this and go, well, I don't know what to do. And I've never, gone over the information on what to do if my patient's tracheostomy tube dislodges. But let's look at the options. So option number one, grasp the retention sutures. There's sutures that kind of help to open it, to spread the opening. Is it two, call the primary health provider to reinsert the tube? Is it three, call the respiratory therapy department to reinsert the tube? Is it four, cover the tracheostomy site with the sterile dressing to prevent infection? What are you thinking about when you're looking at this question? Yes, Victoria.
So I know like with 2 and 3, you wanna like you wanna like be able to help them breathe first. So you're not gonna want to call them right away. Like, wouldn't you want to like if they is like open or like dislodged, you would want to like either like cover it first and then call your provider, like help them and then like call somebody?
Okay.
Because you're thinking airway, breathing, circulation. My patient's route of breathing has been dislodged. Jenna-Lynn, you wanted to add something else to that?
I was going to say more or less the same thing. One of my friends, she's a nurse, and she told me that it's always, as a nurse, you have to intervene to help the patient before you call a doctor. So this is why I'm iffy with 1, it's between 1 and 4, but I'm more thinking it's 1, because you actually helping the patient to keep the thing secure before you make any other intervention to help to assist the patient. So that's my
opening up the area. So think about it this way, Jenna-Lynn, too. When somebody's in cardiac arrest, right? What's the first thing that you're going to do, right? Think about it. When somebody's in respiratory distress, what's the first thing that you're going to do?
Airway, make sure the airway is patent.
Yeah, and then you're going to call for
help.
Help. but you're securing the patient's airway first. So even think about it in that sense. Somebody's in respiratory distress. I'm wasting time. Remember, they can spiral down quickly if there's a respiratory issue, right? The longer that we wait or hold off on providing this patient with, a patent airway or additional oxygen, would decrease in that patient's odds of survival. You assist the patient first, and then you can call for help in the process of you doing that.
I'm also going to just jump in and add, when you call the provider, what do you think the provider is going to say to you?
Oh, what did you do?
Thank you. Exactly. Thank you. There are going to be some instances where you are going to call the provider right away, but it depends on if you have to have a lot of information in the question about the patient, and the question will already tell you, like the nurse already assessed or did something about that patient. Now what's the next steps? That's when you're going to be notifying the provider becomes priority. But again, does this question give you enough information for you to say that? And then again, it's asking you too, what is the initial nursing action? So the first thing you should be thinking, Trey, okay, that means my patient has an artificial airway. That means my airway can become compromised. That trumps that. We'll call the provider later. Safety.
Yeah, safety. Initial is the key word.
Initial, yes.
So it's correct. Grasp the retention sutures to spread the opening of that tracheostomy site, airway breathing circulation. You're allowing the patient to breathe, and then you can call for assistance and be a little weary of any question response where they have two options where you're calling someone, right? Call the primary healthcare provider to reinsert the tube. Call the respiratory therapy department to reinsert the tube. That should kind of like trigger something here. Is that really my initial action? So identifying possible problems. What are possible explanations of the patient's condition? Explain your thinking, right? Based on the information in the scenario, what are possible problems the patient might have? Considering possible problems of this patient, what is the priority? Why? If the patient's symptoms were X, how could that change your thinking about the patient's condition? We also need to identify interventions. What outcomes are most important for this patient in this particular situation that we're dealing with? What interventions are indicated for this particular situation that we're dealing with? Is there evidence to support those interventions? In what ways will the intervention promote the expected outcome of care? Are there interventions to avoid? And which ones and why? So let's look at this next question. The nurse is reviewing the plan of care for a client with a diagnosis of sickle cell anemia. So some of you are like, oh, did we do sickle cell yet? I don't really know. And believe me, when you take your state board exam, or I should say the NCLEX, next generation NCLEX, there's gonna be a lot of information that you encounter that you're not gonna be familiar with. But let's look and see what this question is asking.
Well, I think sickle cell is normally covered in peds.
Yeah, we do cover in peds. Everybody here been in peds?
Yeah. I think so. Yeah.
Okay. All right. So which client problem would the nurse select as receiving the highest priority when planning care? Okay. So now we're looking at prioritizing airway, breathing, circulation, what's most likely to kill the patient the quickest if I don't intervene at this time. So
what's
again,
gonna make me call the provider at 2:00 in the morning? I'm sorry.
Exactly. No, it's good. What's gonna make me call the provider at 2:00 in the morning, right? So which client problems? So in this question, it's giving you a list of client problems, right? So here are my 4 problems. So would the nurse select as receiving the highest priority? So out of these 4 client problems that I have, what should receive the highest priority? Is it 1, dehydration, 2, nervousness about the disease, 3, embarrassment about appearance, 4, inability to cope with lifestyle limitations imposed on as a result of the disease? What would you call the doctor at 2:00 in the morning for?
Jalen?
Dehydration.
Okay, and why? I know you.
You said it at the same time. Why?
Yeah, why?
What's the rationale?
Think about it.
I'm trying to think.
Okay.
Don't think too hard.
It's simple. Victoria, you had your hand up and then you put your hand down. Did you want to say something?
Yeah, well,
Sure.
can't your like red blood cells clump together if you're not like hydrated enough?
Okay.
And then
Very
also,
good.
wouldn't the like 2, 3, and 4, wouldn't they be like kind of all the same concept of like the patient themselves are like worried about themselves, not so much like I'm not sure how to explain this, but like
Yeah, we know what you're trying to say. More like psychosocial.
yeah.
Right.
Think Maslow's. Think Maslow's.
Maslow's hierarchy of needs. So, do I care about your thoughts and feelings, or do I think about physiology and oxygenation, airway, breathing, circulation, etc., etc.? Arlie?
I was gonna say, I think what stumped me is I did end up like in my own thought process, I ended up going with dehydration, but the word choice of inability to cope threw me off. But I guess I see the point because it's more of an emotional thing, and dehydration, you're gonna put them through the stress response, and then that causes a whole different.
Oh, here she goes with the stress response.
You know that was my student, right? Very good, Arlie. Very good. Because what happens in sickle cell anemia? Sickle cell, Victoria, you talked about it before, that in sickle cell anemia, we're talking about the changing in the size of the red blood cells, right? They are sickle shaped. So from it changing into the size of the red blood cells, it being sickled, it affects how much blood is being pumped. Therefore, it affects your patient cardiac output. So if I have an effect on my cardiac output, that means that now is going to affect what my overall circulating volume. That if it affects my overall circulating volume, that gonna triggers and it's gonna initiate stress. Hence why you end up getting the dehydration with patients that have sickle cell anemia. So Arlie, very good.
Very good.
Very,
And
very good.
along with that,
Mhm.
that clumping can occlude blood vessels,
Right.
decrease, oxygen-rich blood perfusion to the
Yep.
tissue itself.
Of course. Very good.
All right. So very good, very good. Note the strategic word highest priority and focus on the subject. So a client problem in the plan of care period, apply to clinical judgment, cognitive skill, generate solutions to plan care period. To correctly answer this question, use Maslow's hierarchy of needs. I don't know why I have dairy in there. That's what happens when you try to do talk to text. Okay. So the other three options are psychological needs, right? And may or may not be concerning for that client, but remember that psychological needs, physiological needs are the priority over psychological needs. So implementing interventions, taking action. What interventions are most appropriate? What interventions should be done first? Why? We always ask the why. It's great that you're coming up to the conclusion, you're bringing up the correct responses. Perfect, but why are you getting there? How are you getting there?
Right.
What information would you teach the patient, caregiver prior to discharge? Important information they also want to know. What information, event, or situation should be reported immediately to the manager, to the healthcare team, anybody else, and why? So let's look at this one on implementation. The nurse is caring for a pre-operative client who verbalizes a great deal of anxiety about the surgical procedure scheduled in 2 hours. Which action by the nurse would best alleviate the client's anxiety? So we're looking at what we're implementing that's working towards best alleviating the patient's anxiety. Would it be 1, stay with the client until he is brought to the operating room? Would it be 2, call the client's wife and ask her to visit the client before surgery? Would it be 3, talk to the client for 15 minutes and return shortly thereafter to check on the client? Or would it be 4, tell the client you will spend some time answering his questions as soon as you get your other tasks completed? What can you eliminate?
Yeah, the one that's least therapeutic. Arlie, I think it was your hand, and then Victoria's.
I think we would definitely eliminate number 4 because it's very dismissive of his anxiety and like what he's going through. It almost makes it seem like we're telling him we have more important things to do when we don't want to do that.
Correct. Victoria?
I think we could also eliminate number 2, calling the client's wife and asking her to visit before surgery, because like we don't know. There's not enough information about the client's wife.
Jenny Lynn, I think you have something to add also.
Okay. Oh,
And I don't think it's number 3 because even though you talk to the client for 15 minutes, that doesn't say that the client's anxiety has decreased. And then leaving the client to check on him later, that doesn't, like I said, it doesn't say the anxiety could be still there. I think the best thing would be to stay with the client until he will get that reassurance if you stay with him, and he will feel much better, and you could help him cope or deal with the anxiety. That's
okay.
And Arlie,
I honestly thought the opposite, but I'm not sure now. But my thought process was when you're talking to him for 15 minutes, you're taking time, and if he has questions, he'll answer them, or we'll answer them. Sorry.
it's okay. It's all right. Take your time.
It's returning to check on him to see if his anxiety has gotten better or offer more assistance. I think staying with him, and it doesn't specify if we're talking to him or helping him in any way, just staying with him not only takes away from our time. I don't know, but that's just my thought process. I see where you're coming from with the other thought process as well.
Jenny Lynn, you have something else to add?
Yes, I was saying that returning shortly after to check on the client. It didn't tell if the anxiety has decreased. Then in that thing, it didn't say anything about his anxiety being decreased. So I'm kind of like iffy. So I know it's either between 1 or 3, but yeah, I'm more leaning to 1. Yeah.
So we have the struggle between 1 and 3, right? The major struggle. Probably wondering, well, I think Arlie said, do we have time to sit with this patient until they're brought?
I was gonna say that guys, for the NCLEX, we got all the time in the world. On the NCLEX, all of the equipment works.
See, I did a what if right there. I did. That's what I did.
Yeah, I was waiting until we got to the talk about the rationale part. That yes, that's a what if. Yep. So you brought what if in there. No what ifs.
You did. You brought the what ifs in. We have all the time in the world. Everything works. Yep. We're very well staffed. Yes. Management is awesome.
Yes.
Yes. This is the ideal, beautiful world.
Yeah.
Don't assume I'm working today and then there's only 2 of us and there's supposed to be 5 nurses on.
Right.
So note again the strategic word best and focus on the subject. Alleviating the client's anxiety is the subject. So apply to clinical judgment. It's supposed to be cognitive skill, take action. As you're reading the options, you may hesitate to select option 1 and may say to yourself, I could never stay with a client for 2 hours, right? Because that's the first thing that came to your head, 2 hours. I would never get any of my other clients taken care of if I'm sitting with this patient for 2 hours. Stop right there and remember that on the NCLEX exam, the only client you are caring for is the client in the question, right? Yep. It's beautiful. I'll be thinking the same way. Where do we have time to sit for 2 hours with this client? We don't. We don't. In the ideal world where time is, unlimited and staffing is great and equipment is working, need to follow suit without making assumptions and doing the what if. Yeah. So now evaluating outcomes. What are important findings to monitor to determine if the patient is improving? Is the patient improving? Why or why not? Are the interventions we're using effective? If not, what other interventions and approaches should be considered? What observations would you make or question would you ask to assess if the patient or caregiver knows how to perform the procedure, give oneself the treatment, follow the protocol? Evaluation is very important. So now let's look at this question, focusing on evaluation. A client recovering from an exacerbation of left-sided heart failure has a problem with tolerating activity, right? It's heart failing, not doing too well, can't tolerate activity. The nurse determines that the client best tolerates mild exercise if the client exhibits which change in vital signs during activity. So here's my patient. They're tolerating mild exercise if these changes are noted. Okay, so let's take a look at the option. Pulse rate increased from 80 to 104 beats per minute, right? Oxygen saturation decreased from 96% to 91%. Respiratory rate increased from 16 to 19 breaths per minute. Blood pressure decreased from 140/80 to 110/68. So which changes during mild exercise indicates that the patient is tolerating? What can you eliminate first?
The drop in BP.
So you want to eliminate the drop in BP first.
So they're tolerating. Yeah, because if they're exercising, wouldn't it be an expected blood pressure increase because they're working their body and their heart's pumping harder?
That's one good way to rationalize that. Anybody else? Is that all the input we're getting?
Yeah, Arlie was the only hand I saw up.
And there's something else I want you to, Victoria.
Oh yeah.
Would you wanna eliminate the O2 decrease? Because wouldn't we like our heart rate is like our respiratory rate's going to increase and our pulse rate's going to increase because we're like working our body. And if our oxygen's starting to drop, we're not
Would
tolerating.
you continue to have the patient exercise with their oxygen saturation dropping?
No. Because wouldn't actually I don't know.
No, that's okay. It's good. Think through it. Think through that whole process. So the question is, the nurse determines that the client best tolerates mild activity if the client exhibits which change in vital signs during activity?
Arlie.
So I think Victoria's right with eliminating 2, because if it's gonna drop, you're not gonna continue because 91 starts to get a little bit like nerve-wracking. And then I guess for the pulse rate increasing from 80 to 104, I would consider that normal, but I guess if we're looking for one answer, I guess the best moderate like increase would be 16 to 19 breaths per minute, which is what I would select, but I don't know if that's true. I'm stuck between 1 or 3.
There's always a struggle between 2, right? 2 of them. There's always a struggle.
Mhm.
All right, final answer.
Oh yeah.
The excitement.
Oh, I thought I was muted. Sorry.
That's all right, the excitement. So note again, the word best, focus on the subject, the client's ability to tolerate exercise. Apply to clinical judgment, evaluate the outcomes, use the process of elimination. This is one of those where, of course, I could hear you all struggling. So I said, see what you can eliminate first. Of course, that drop in oxygenation, will we continue? Is the patient actually tolerating that exercise activity if their oxygen saturation is dropping, right? And someone made a good point that activity, would the patient go from being 140/80 to their blood pressure dropping as an indicator of them tolerating that activity? So option 1 and 2 are incorrect because they represent changes from normal to abnormal values. A decrease in blood pressure more than 10 millimeters of mercury could indicate an orthostatic hypotension change and that the client is not tolerating the exercise. The only option that identifies values that remain within normal range is option 3. Give yourself a pat on the back for that one. Option number 3. Okay. So this is the last one on here. And I actually took a little piece of something from what would have been a bow tie question. Little nurse's note, some vital signs that I'm going to read to you, and then let's see if you can come up with the correct response. So the client admitted to the unit for a lower GI bleed, continues to have frequent bloody stools, and is scheduled for a lower endoscopy in 4 hours. The client is receiving their 4th unit of packed red blood cells. Unit of 4th packed red blood cells started at a rate of 250 cc's per hour. 30 minutes after the transfusion started, client started reporting dyspnea, difficulty breathing, and they're restless. Crackles are auscultated in bilateral lower lobes. Oxygen saturation is 92% on 2 liters via nasal cannula, and jugular vein distension is noted. Their vital signs, temperature is 99.1, blood pressure is 189/90, pulse rate is 100, respirations are 28. Now, before we go on, is there anything that concerns you in this little scenario?
I was gonna say,
The respiratory rate's kind of concerning, and also that their clients having like continuous frequent bloody stool. Wait, actually, never mind.
That's okay, it's okay. So their respiratory rate is concerning.
I would say the crackles and the jugular vein distension is.
So what does the crackles and jugular vein distension indicate?
Crackles means there's. Oh, Victoria, you can answer.
No, you can do that one. It's fine.
Okay, I
Wait,
think
what did you say?
crackles means fluid in the lungs.
Yes,
overload.
fluid in the lungs, right?
Because remember, guys, look at what the question says. The patient comes in for a lower GI bleed. Take out the clues or the cues from the question. You have a patient that comes in with the lower GI bleed. You have the patient is still active, look like they're actively bleeding because the patient has frequent bloody stools. Then the question also says to you that he's receiving his 4th unit of blood. 4th unit of packed red cells. Blood is also, remember, we're replacing volume, right? So the 4th unit of blood, and it also the question tells you 250 cc's an hour is what the client was also getting the fluid at.
Mhm.
Yep.
And
So that's
30
key.
minutes.
That's
key.
key.
And here's the other key I always say. You're doing something, right?
Yeah.
You're performing a skill, or you're performing an intervention.
Mhm.
30 minutes after the transfusion started. So this is something that you've started,
Yep.
right? Transfusion. 30 minutes after, they're reporting difficulty breathing, dyspnea, and they're restless. You auscultate their lung sounds, you hear crackles. Your oxygen, does this say that they're a COPD patient? Does this give any other significant reason why it's okay for their oxygen to be 92% on 2 liters? Via nasal cannula, and then of course jugular vein distension, and then you mentioned the respiratory rate on top of that.
Exactly.
Right? So keep that in mind, right? Keep those some of those cues in mind.
Mhm.
Let's go to the first part.
Yep.
So with this type of question is what you call your bow tie question in the next generation, where you pick one option for one part of the question, and the additional questions will probably ask you to pick 2 or 3. So for this one, you know, regardless of you learning all of this information, whether you've covered it as yet in class, I want you to use the process of elimination with all of the data you've been provided with, all of the assessment data. So Arlie, do you want to answer it already?
Oh, I wanted to answer why it probably no.
Go ahead, let's hear it. Let's hear it.
Because now I'm like questioning myself, but I'll go with it. I think it's A, because I thought when I was reading it first, it was a reaction to the blood, but since as we reread the question, it's his 4th unit and he has distended neck vein, so that's a sign of hypervolemia.
Hyper what?
Hypervolemia.
Oh, very good. Week 1 of med surg 1, very good. Jugular vein distension, very good.
And then so that's kind of where my thought process is, because I definitely could see why someone would pick after reading it the first time C, but I'm gonna go with A.
Okay.
Anybody else? Very good rationalization.
Holly, you on a roll. Yay.
Thank you.
So the correct response, or the correct choice, the potential condition is transfusion associated circulatory overload. A lot of cues there. You gave them their 4th unit of blood at 250 cc's an hour. 30 minutes after, they got crackles, jugular vein distension, difficulty breathing, they're restless, and their oxygen saturation is 92% on 2 liters. Okay. So actions to take. These are orders that are available for you, okay? You're gonna be choosing two of these orders, which would be appropriate for this patient who has transfusion associated circulatory overload. Would we be decreasing the infusion rate? Would we be administering furosemide? Would we be administering an antibiotic? Would we be administering diphenhydramine? Or would we be administering epinephrine? You need to look at those drugs or the orders and ask yourself, why would this be the correct action to take? What can you eliminate now
Mhm.
with the information you've been provided with? Yes,
Victoria?
I don't know if this is right, but furosemide is potassium sparing. So if they already have overload, wouldn't you want to not give more potassium because then it can go into hyperkalemia? And then like have like risks from that?
But think about it, Victoria. For someone who has volume overload, how do you get rid of volume?
Oh, the diuretic. So then
But furosemide is potassium what?
wasting. Oh, it's wasting.
Mm-hmm.
Arlene?
I think I'm gonna administer, gosh, no, get rid
You know
eliminate.
what you meant. Which one you gonna get rid of? Yeah.
I'm gonna get rid of D because isn't that just Benadryl? It's not gonna do anything. Like, right?
It's Benadryl, that's correct.
Benadryl, yeah.
That's
So you
what I
got rid of D.
Mm-hmm.
I guess we're not gonna there's no reason to give an antibiotic. They don't have a bacterial infection that we know of. So and so I'm gonna say A is decrease. You're gonna either decrease it. I don't know why they haven't stopped it, but decrease the infusion rate and then administer the diuretic to get their fluid out is what I would say.
Okay. You on a roll.
Right?
Good.
So the patient, in some cases, you'll still see them administer the blood, especially if the patient is profusely losing a large amount of blood. It's just that the volume that they're receiving in this short period of time is too much for their body to handle. So we can slow down the rate of infusion. You know, if they were having a transfusion reaction, that wouldn't be a case where you'd slow down the transfusion. If they were having a transfusion reaction, that'd be a case where the transfusion would be stopped. But in this case, the culprit here with this patient is that they're receiving too much volume in a set period of time. So the correct response would be decrease the infusion rate, because this action to take, I told you two options would be correct, right? Epinephrine, they're not appropriate for, epinephrine. At this time, what's the purpose? You have to ask yourself, why would I be administering epinephrine? You're correct, diphenhydramine, they're not having a transfusion-related reaction. Why am I administering this? Antibiotic, there's this scenario is not showing me an infectious process. Why would antibiotic be correct? The problem here is the patient is in circulatory overload. And what two options are appropriate to manage circulatory overload, but decrease the fluid that they're receiving that's causing this overload, and to administer a diuretic to help rid of some of this fluid in this case, which is, you can see the patient is exhibiting crackles, they're having difficulty breathing, jugular vein distension. So this would deal with that issue at hand. And of course, with this choice, it tells you to choose two options. The last part of this, what we call bow tie when it comes to the next generation question, just realize one thing. It's telling you what's the condition, right? You already chose the condition, circulatory overload. It asks you, what actions would you take for this patient? And you've chose to deal with the circulatory overload by decreasing the fluid and giving the diuretic. Now, what parameters are you going to monitor for this patient with circulatory overload that you have decreased the fluid for and administered furosemide? What would you be monitoring in this patient?
Intake and output and weight, because you want to know if they're actually losing the excess water. I don't want to say the excess fluid that they're holding on to, which would be taking their weight, and then intake and output would be making sure what's going in is coming out, because if they're having overload, that might, it's holding on to it.
Very good.
Very good. You notice with C, D, and E, these all can indicate some sort of reaction to the blood transfusion. But in this case, the problem or potential condition is not an anaphylactic reaction. It's not a hemolytic reaction. It's not a bacterial reaction. It's circulatory overload. In this case, you're taking two actions, which is appropriate for this circulatory overload. And you are monitoring the correct parameters to whether this fluid is, continuing to come out as we're giving this diuretic, right? As we've decreased the fluid, is it working, or is it, are we getting the evaluating appropriate outcomes on this patient? This is where it comes down to evaluating the outcomes. Very good. Any questions on? This is actually one of your NGN type questions. Very good, because it helps to measure or assess your ability to critically think, because you're going to be dealing with patients, in this case. You're assessing the patient, you're gathering the information, you're going to notify the physician in the report, your SBAR, whether it be the next oncoming shift or the physician. All of this data you're going to utilize to provide the appropriate treatment, and then how do you evaluate the outcome of those treatments, but by intake and output and your weight. Does that make sense to everyone, or any questions about this? Going once, going twice. So the nurse should decrease the rate of the transfusion, administer furosemide or other diuretics. So who was it that was saying about the potassium level? Was it Victoria or Lynn? All right. So even in the case, if you were giving somebody a diuretic and there's an issue with the potassium, this would be information that you would communicate with the physician after you looked up their labs, and they have an option whether to provide a diuretic that's potassium sparing or potassium wasting, all right? Potassium losing or potassium sparing. So other diuretics as prescribed, because the client is most likely experiencing transfusion-associated circulatory overload. The nurse should monitor the client's intake and output, as well as the client's weight, to assess volume status, especially after the diuretic is administered. All right, I think that's the correct scan though. Any questions? And do you feel like this content was beneficial when it comes to clinical judgment?
Absolutely. I caught myself doing what you guys were talking about a few times, so it
The
definitely
what
was,
if? Yeah.
yeah. And
Yeah.
even before with the when we were doing the deep vein thrombosis question, I literally did that in my head. I like read deep vein thrombosis, went to the answer choices, was like, oh, it's probably this, and then I
did
read
the
the
same
question.
thing too.
I catch you all doing this quite frequently.
Yeah.
When I look, I was like, wait, they didn't read the question.
That's not what I was asking. Yeah.
That's not what I was asking. And, a lot of you get caught in that, web of going through, and you're familiar with a piece of content, or you're familiar with a topic area, and you get excited, like, oh, I know this. This is what I'm expecting to find in this, or this is the treatment. But that's not what the question is asking you. I'm happy that you know the content, some of the issues that comes along with the content, but are you really asking, answering the question? So if that's one of your biggest issue, what I always suggest to do is, before you leave off on that question, is asking yourself, did I actually answer the question?
Yep. And I always say, just go back before you click your final answer and click next. Just read the stem, the last part, the last sentence of the question. Just read that last part and see if your answer choice matches up with it. If it does, you're good to go.
Sometimes you need to start off with that. If still you need to like retrain your brain. Sometimes you need to start off with that question piece and then go to the rest of it. And if you have trigger finger, like where, oh, I already clicked it and my brain processed it after I got off to the next question, try to be one to keep your hand away from, the keyboard.
Next. Yeah, clicking next. And just always remember too, which is a key part of clinical judgment. And I think we've emphasized this throughout, since we did from the last workshop and then this one, is also to really paying attention to the question and really assessing and seeing in the question, like, do I have enough data? or do I need to do further assessment for data? Because you're going to find a lot of questions that you may encounter. You may not even have to do like a big nursing intervention. You just need to do a further assessment, whether that's a cardiac assessment, a GI assessment, GU assessment, a history taking, whatever, just so you can collect more data in order for you to, to take care of the patient. Or for, how should I say, a better patient outcome, I should say it that way.
Improve
Yeah.
patient outcomes, absolutely.
Yeah.
Right. Any other questions before we end off?
Professor
Neither.
Graham, I don't know if this is like allowed. I do have a question about like some clarifying things about the essay. I don't know if that's allowed. I can email you if that's
The health promotion